Yeah, thanks, Sabrina. Thanks you, and thanks everybody else for the case and for the discussion and the recommendations. That was fantastic. All right, so so our presenters today, like you can see, are many, and they're all going to have a different view and different perspectives. And we thought collectively, I think it'll give you a nice overview of some family supports to consider and hopefully put into your toolkit. All right, next slide. So again, the Family Echo Autism, I mean, really what this series does is it really strives to share like medical and behavioral information that we know, that we use in the clinic, that we try to give to our families, that we know is helpful for raising children with autism, and really getting that into your hands. You know, one of the things that we try to do is we try to provide equity and knowledge, meaning that everything that we know, we want to make sure families know. And being a parent myself, I know how valuable this is because I feel like it's helped me to learn a lot. I'm parenting my own child. And helped me to learn skills and also to look at the skills I already had and really amplify them. So that's really what we're going to strive to do. And I think over the course of this next 40 minutes with this topic, you're going to see some of those things. Next slide. One of the things you're going to hear me say every time we do this session is how powerful your voice is on care and treatment teams and how equal it is. You know, when we look at all of those disciplines that are surround a child with autism, and you know, this is the image gives you, you know, how many different teams and different avenues and different comorbidities we could be, you know, dealing with. The family is always central to that. So your participation, your knowledge, your voice is incredibly important. And we really want to empower you to, you know, learn this, take it back to your own families, your own healthcare providers, your treatment teams, your community, and really start to get this knowledge flowing so that we can all learn from it and all build on it. Next slide. You know, I think one of the things that we always want to share too is that, you know, you have a really strong leadership role on your child's care team. You know, and when you look at all of the teams and all of the individuals on these teams that you're going to interact with, it's a lot, it's extensive, and it's ongoing. And some of them are daily, some of them are monthly, some of them are yearly, but they're ongoing. And you are a huge broker of information and knowledge because you are a parent, you know this child well. And so your role on these teams is significant and your voice on these teams is significant. And one of the things we wanted to talk to you about today is, you know, that role as well as supporting yourself in that role. So Laura, let's go to the next slide. One thing that I can say that I've learned in being a parent of my son, Henry, is that leading these teams can be really hard, you know, and having a leadership role in these teams can be really hard, you know, because there's so many things that I need to learn and there's so many people and items that I need to connect and, you know, and there's so much engagement that needs to happen, you know, for so many different reasons, you know, whether it's just engagement in an autism community or engagement in, you know, just my community around me. You know, it could be advocacy, it could be so many things. So as this series is hopefully going to assist you in thinking through the leadership of you and your child's team and providing you with some of those skill building opportunities, you know, like how to manage information and how to manage all this information amongst all those team members, like we saw on the last slide, you know, and how do you communicate this information and, you know, as well as take care of yourself during this whole process, right? So today, if you want to go to the next slide, Laura, I think we're going to just focus on maybe 5 of these today. You know, really we're going to look at, you know, building relationships with team members, you know, what are the roles and responsibilities of each? And Becky, you're right, it is overwhelming. I mean, it's completely overwhelming. And that's, I think, the goal that we have right now for, you know, this series is to help us understand and compartmentalize and as well as, you know, put it all together. So, but we're going to talk about roles and responsibilities on teams and how to identify that. We're going to talk a little bit about understanding the value that you bring to this team. Again, essential is your voice, essential is your knowledge. You are the person who's going to take action back to your child from all of these teams and make things happen, as well as make sure that teams have information so that they can make action happen. I think understanding your own family system and, you know, how do you connect with within your own family dynamic? How do you connect with your child too? I think, you know, I have a child who does not have a lot of language, pretty limited in the number of words that he uses. So figuring out how the best way to connect has, you know, always been, you know, something that we've strived to do. Even now that he's, you know, in his early 20s, we still seek that out. So it's an ongoing sort of journey for us and our family. I think also, you know, Maddie's going to talk about advocacy and, you know, trusting your instinct and advocating for your child, but also in some ways advocating for systems change so that the struggles that you may have had may not, have to happen for children who are coming up that are 10 years behind you. That can take a long time, but your voice can be really powerful and systems change as well. And then I think, Sapna and Sabrina both are going to talk to us about taking care of yourself, asking for help when you need it, understanding goals and treatment, how to recharge yourself, and where to go to look for help when you really need it. So we're going to go through some of those today. And if you have, again, if you have great things that have worked for you, please drop them in, especially if they're resources, and we'll share them. So I'm going to turn it over to Sapna, and Sapna is going to talk about how do we balance it all. Sapna?
Thank you, Amy. How do we balance it all? Working from home or working on site while maintaining household tasks as well. And the new and changing schedules can also create stressors within family relationships. Ensuring children are keeping up with day-to-day responsibilities also tend to be ongoing struggles. And there can also be financial stressors. Loss of job or reduced hours can also create stress for family systems. And then we'll move on to the next slide. So as Amy mentioned, self-care for parents is really important. We can move on to the next slide. So this is so important, and it sounds simple, but can be so easily forgotten. Taking care of yourself allows you to be the best that you can be. So when you take care of yourself, that gives you the strength and ability to take care of your loved ones as well. It's also really good role modeling for the rest of the family system as well. And then we can move on to the next slide. So we'd love to hear from all of you ideas of what you might be doing for self-care. So please feel free to share via the chat feature that we have with us today. Some ideas that we came up with is trying something new. Is there an activity that you've always wanted to try but haven't made time for? It could be something like painting, bike riding, poetry writing. So anything that you've always thought about but haven't made time to do so. And just giving yourself that time, even if it's not a lot of time to try something new, giving yourself whatever time you might have the ability to do so on a day-to-day basis. And then meditation and exercise can also be a really amazing way to release stress and negative energy as well. And again, it doesn't have to be an extended period of time. Even if you could fit in a 15 minutes walk in the morning or a stroll in the evening, that can also help tremendously. And then letting yourself get distracted. So taking breaks to go for a walk, get some fresh air, or even just listening to music. It can also be really helpful to limit your exposure to social media and taking breaks from the news as well. And then we can move on to the next slide. So practical strategies can include building a routine to your day with the support of a visual calendar. And the key is to find a spot for the calendar that can be seen by all. So the visual calendar can also be a place where roles are identified for each family member. Also exploring supports outside of your immediate support system. So this can include school staff and therapists. They may have ideas or strategies that they've been implementing that can then be generalized into the home environment. So again, it's about collaborating with your team and other providers or team members that might be working with your child as well. And we can move on to the next slide. And then also reaching out to extended family for support. That can be grandparents, uncles, aunts, and sometimes even close family friends. Older siblings can also help with younger siblings, and that can be a good learning skill as well. And I think sometimes we forget to slow down. So when life gets hectic, we continue to push and expect the same amount from ourselves and from our children as we typically do. It's really important to remember when things do get heavy and overwhelming that it's okay, and really important to give yourself permission to reduce the expectations for yourself and for your family as well. And then most importantly, practicing gratitude. So I think sometimes when there's a lot of things that are hard, we forget about all the amazing things that are present within our lives as well. So reminding ourselves of what we do have and what is going well can help create a sense of balance too. And I'm going to pass it on to Sabrina.
Thank you, Sapna. So, kind of going along with that is this idea of healthy thinking. So how you think can play a significant part in how you feel and how resilient you are when you're faced with obstacles. So trying to practice flexible thinking helps you adopt a more balanced and realistic thinking pattern. So you may not always be able to change a highly stressful event, but you can change the way you interpret it and the way that you respond to it. Next slide. So some ways to practice healthy thinking. Look for the silver lining, no matter the size. This doesn't mean just ignoring bad or unpleasant experiences, but rather creating opportunities to search for positivity while accepting the negative. Practice gratitude. There's a lot of different gratitude apps out there. Laugh. There's obviously a lot of different videos and things that you can look up. There's actually something called Laugh Therapy. If anyone wants to look that up, I think it's really fun. And then practice positive self-talk. So research shows that even a small shift in the way you talk about yourself can influence your ability to regulate your feelings, thoughts, and behaviors under stress. Next slide. So here are some other types of recovery and self-care. And I saw a lot of these in the chat. So there's physical self-care, you doing either passively sleeping or actively doing something like yoga and stretching. There is mental, so giving yourself a little bit of a break, taking 5 minutes for yourself. I think I saw Amy say that in the chat, just taking a few minutes for yourself, a mental break, not a mental breakdown, but you can do those too every once in a while if you need them. Doing a sensory break. So having these intentional moments of sensory deprivation. So kind of taking out sound or light or something that, gives you some time to recover. There's the creative mode where you can look into new different things that you might be able to explore, art or listening to music, any of those things. Emotional is setting boundaries for yourself. So saying no sometimes instead of reluctantly saying yes. Social would be surrounding ourselves with people that are positive and supportive. And then spiritual is creating a deep sense of belonging, love, acceptance, and purpose through prayer or meditation or community involvement in your daily routine. And in the resources that you'll be receiving later on, there are going to be some different resources about rejuvenation. So you'll get those in the link in the resource document. Next, I think we go back to Sapna. Yep.
Yep, thank you, Sabrina. So family dynamics within the system. So when looking at the relationship within the family system, the quality of each relationship within the family can create either a strong or a struggling family unit. Accessing supports to work on challenging dynamics can benefit the entire family system as a whole. So when working with families, I typically tell families as well that I can provide supports and help create positive change, even if I just have one family member within sessions with me. So there might be a child or even an adult in the family presenting with the problem behavior. But if we were to look at this systemically, we would be perceiving the person as carrying the symptoms for the entire family. I often tell my families it isn't about fixing the problem, but it's about healing the family system. And I did love seeing, even with our recommendations for their case, that there were a lot of us who were recommending family therapy or looking for ways that we can create support for the entire family system and not just the child. So family therapy can help couples, blended families, children, or members of an extended family learn to communicate better and to work through conflicts. It can also be used as a preventative measure. So if a family is moving through separation or an upcoming challenging time or transition, it may be helpful to connect with the support to prevent family members from going through crisis or extended conflict, and can also work on preventative strategies. So family therapy can provide new skills to get through difficult situations in healthier ways. So this service can average up to 12 sessions. However, frequency and duration typically depends on the family's needs. And I think we're going to shift back to Maddie.
Thank you. So what is advocacy? Well, a definition that I found that I really like is any action that speaks in favor of, recommends, argues for a cause, supports or defends or pleads on behalf of others. In other words, you are your child's biggest advocate. And that comes with challenges and barriers, especially for when we're first starting to face some of the things that we need to fight for our kids, and so much that we don't know about. So knowing how to verbally express what you're looking for. What are the words we need to speak in the first place, that will help. We need to understand the resources that are around us that we're just unaware of, in our own families, in our own circle. Knowing who and when to ask for help. Sometimes you get to a point where you can't do this on your own, and when you acknowledge that and seek help, that's a good way of moving forward. That's a good way of advocating for yourself and for your family and for your child. So as you grow with this, you start beginning to recognize what are the tools that are necessary and where to find them and who has them. Next slide. So the first thing is, and this could be a brain scratcher for some people. It's okay to ask for help. We try to teach that with our kids, but sometimes we forget for ourselves. We can't know everything. We can't be expected to know everything about what our kids need, about what our families need. Until you face it, you know nothing about it. So it's okay to ask for help to find that path that's going to lead your be able to advocate for your kid. So the first thing you do is find other caregivers, who are dealing with this already. The stories and the experiences that others who have been down this journey, down this path, they're an immeasurable worth. They're the treasure trove, because you aren't doing this alone. This is not the first time that a particular issue has happened to a family and an autistic child. There are others who can help guide you through the things that didn't go well for them, as well as the things that did go well. It can be easier advocating for systems change than for our own kids. This is the big thing that I have found. Trying to fight teachers and administrators and school officials is much harder to do for my one child than it is to go and deal with the school board or the trustees or the higher provincial levels to make some of the changes that then the teachers can follow. But if you're facing these things, I guarantee you other families are having the same issues, and joining up. The more numbers you have, the bigger the impact of the probability that you can actually get the change needed. Document. Write everything down. Keep track of the notes. Every conversation that you have, especially with schools, keep all the records. Find a system, and again, talking to other caregivers that may have been doing this, figure out what they're doing. But documenting saves you so much energy and actually helps bridge the differences between the different professionals that are and medical people that are going to be in your family's life. And the last thing, and the most important thing, trust yourself. Trust your gut. You are the one and the only one who knows your child thoroughly. And you are the one that is best to connect everyone else to your child. That circle that we saw, that that has the family and the child, it's bigger. Everybody needs to connect to you and to your child, and you are that glue. You are that bridge. And again, it's okay to ask for help and take breaks for yourself. Thank you.
Thank you, Maddie. Part of advocacy and language is starting to talk through just different terms that you might hear with regards to autism and neurodiversity. You may hear us use a variety of terms when we talk about autism. You may have heard these terms already. You may have heard me say I have 2 siblings with autism. You may hear diagnostic language, like a child is diagnosed with autism, or particular diagnostic categories like autism spectrum disorder, or previously used diagnoses like Asperger's syndrome. You may also hear terms such as autistic individual or autistic child. What this is really reflecting is the difference between person-first language and identity-first language. Person-first language is reflected with the person with autism or person diagnosed with autism. This type of language puts the individual first, and a lot of families reflect on this type of language as a way of emphasizing the person and the individual. Identity-first language is autistic individual, and that represents autism as something that's inherent as part of somebody's identity. It's a part of them. And as I think of this type of language, I use both. For one, I probably wouldn't call myself a person who plays soccer. I would call myself a soccer player. But I may also say I am a a woman who practices psychology, and then other times I'll call myself a psychologist. So I might jump back and forth there. I realize I use both. So as we go through, this is really important because language and words matter, people's identities matter, and their individuality matters. And we're kind of finding ourselves in the middle of both, the importance of language, titles, experiences, identities. And what is most important as I reflect on these different terms is to be gracious and patient with one another. We may get it wrong when we talk and encounter with other people. And I know I've definitely gotten it wrong. But what I see from both sides is that we care about the individual and we care about their value and worth and identity and their worth as a person. So you're going to join us. You're going to be on this journey as we explore different types of language, and you are going to hear us use a mixture of both identity first and person first language as we go along this journey together. You can go to the next slide. So I'm jumping in here as a sibling, and I'm reflecting on what Sapna said earlier, that families exist as one unit. So echoing what Sapna said, but from a sibling perspective, we all exist together. So when one person has a disability, it kind of can feel like the entire family has a special need or unique challenges or stressors. Siblings find themselves in the middle. They are an individual's first peer relationship when in a family when somebody has autism. They're also a lifelong relationship from the start. I've known my siblings my entire life, and they've known me their entire life. And while sibling roles might change, it can include different types of responsibility, caretaking roles, different burdens, stressors, some emotional burdens. And as you put that together, siblings are an important part of the family. You can go to the next slide. I want to put up the slide here about Kubler-Ross's stages of grief and how families adjust and move along, sometimes different stages that you might find yourself in the middle or in one of these stages even today as you are thinking through some of these topics. The classic 5 stages are 1, denial, bargaining, anger, depression, and then acceptance. And so when you think about your family, my family, Amy, I know you've talked about, okay, what stage, that you might find yourself in. Maybe this is hard to deal with. There's nothing wrong. Or if I work really, really hard, if I make all of these phone calls today, all 15 of them, my child will have a great day. Inward guilt or frustration with professionals, service coordinators, teachers. Depression, as you think about how there are implications for the family as we're starting to talk about not just next month, but next year. And then acceptance, being able to discuss with more ease, building competence, building advocacy skills. You can go to the next slide, Laura. What I have found and what I've done some research on is that these stages sometimes are not linear. You can jump back and forth between depression, anger, bargaining, denial, and sometimes these stages cycle through different transitions in life. So you might feel like you've gone through all of these stages. I'm now at the advocacy, I'm ready to go, acceptance at child, in this child school age years, but then all of a sudden you hit adolescence. And there may be new stressors and triggers, new sets of really things to be angry about, things to be angry about with peer isolation, thinking about the difficulties of transition planning and finding a vocation. My family is really, we're finding ourselves in between adolescence and launch. There are new things that we are denying. Oh, maybe he doesn't need these many supports. New things that we're getting frustrated or angry about. Different caseworkers who just don't show up on a Monday morning, different responsibilities and goals that we're trying to support my adult siblings in learning, and new responsibilities. So new sets of things that families are adjusting to. And so I guess I just want to vocalize that can be true, and that's okay. You can go to the next slide. Families often have a unique set of challenges, burdens, as you think about having a child with any type of disability. One, there's the chronicity of care with a child with disability, that this is something that you've worked on really hard for this week, but you also are likely going to have a set of challenges next week. There's social isolation and thoughts that, well, this is something that nobody understands, something like a hidden disability that, well, you could do something about it or you could fix it. But really, at the end of the day, it feels like a lot of people can't really understand. And that stigma or isolation can lead to additional stress and anxiety for families. You can go to the next slide. So I find it helpful to look at the different variables that might contribute to a big family stressor as you're thinking through, well, what do we do today? And there's a combination that we can look at. One is the stressor. Okay, the particular transition event or the unique stressor that your family's encountering, but then also how that intersects between what resources you have as a family and what unique values, attitudes, considerations that your family also has that in combination can really focus on how to tackle this next step. The unique stressors that families can face can look a different way, and some of them might not ring true to you. But you can go to the next slide. For some families, you may be experiencing, this is overwhelming. This is a lot to process. I just got a 30-page report, and this is a lot to take in. Instrumental stress, really figuring out how do we manage this when we're also looking at working from home, different responsibilities, being on an additional wait list. Emotional stress, we heard about that with Trina's family, lack of sleep. Now I have to pack an extra meal for her to take to school. You can go to the next slide. For some families, they may have additional interpersonal stressors. This also was a role in Trina's family, and a few people put that in the chat. What does it look like when families are living in different settings, and how can we support Trina? And then existential stress of how can we find meaning and gratitude. Sabrina's talking to us about gratitude when this is really hard. Now I have something else to be stressed about that I now need to figure out why me. You can shift to the next slide. I think we're off to Cody now.
Thanks, Ellen. So when we think about team-based care, there's actually a science behind this, and it's something that oftentimes medical providers and psychological providers and school providers get trained in, but unfortunately, we often don't have the opportunity to train parents in how we think about team-based care. And so what we want to do today is tell you a little bit, peel back the curtain a little bit on how many of your school medical and psychology teams think about team-based care. So that way you can understand the way that they think and then leverage the way that they think to best get the needs and outcomes for your own children. So on the next slide is the first part of team-based care. So if we can switch to the next one. There we go. The first one is really just to build a team to identify the roles and to identify what each person's responsibility is and how we communicate. And so this is just a very small example of this. This is something that Amy likes to talk about a lot. And it also goes right along with what Maddie was saying, that even though you can maybe keep all this information in your head, it's exhausting to do so. And writing it down can really help think through where are the gaps? Who are my needs? If I'm having a problem, who do I go to? And so you start to write down who the team is supporting your family, right? And so it might be a teacher, and their responsibility might be the general education teacher, but you also might have an aide who's classroom support and collects data, and a speech provider in the school, and maybe a speech provider at the hospital, the school psychologist. There's probably lots of people, a developmental behavioral pediatrician, a primary care clinician, and what are the difference between those two? Whose job is what? And to really write this down and get it out of your brain can help calm your brain down, but it can also help you start to think through, actually, I don't know the difference between what my developmental behavioral pediatrician does and my general pediatrician does. I should ask them at the next visit and to make a note of that and bring it down to the next visit and have a conversation with them about it. So if we can go to the next slide. We can stay on this one, but also don't forget, as Sapna and Ellen were saying, your support team should be written down on there, right? It's not just your kids' team, but you should have your support team on there and the different ways in which you need support, right? So you might have your own therapist or a family therapist or a grandma or an aunt or a friend, and what role do they play on your support team? So it's not just about your kids' support team, it's also about your support team. Who's on your team to help you problem solve some of these things? Another family friend who is also advocating, as Maddie was mentioning, other family members in the school who could team up and help you advocate for additional needs. So the second thing that we think about when we think about really high quality team-based care is to the extent that you can. I know some of us don't live in environments where we have a lot of providers to choose from, but really try to identify and build within the providers on your team, providers who value input from other people, who don't always think they know all the answers, but they find value in getting information from you, from your kid, from teachers. They really value information from everybody, who really believes in this idea that the care is better when we're all sharing information, that when we have mutual respect for each other, and that there's equal value. There isn't a large hierarchy in the relationships, right? So we all have something important to add here, and who really understand and try to follow the scope of their practice. They kind of stay in the lane of what they're trying to help you with and what their role is on the team. On the next slide, what we do next is we really think about communication. So communication really should be both responsive and responsible, right? And so things that I like to coach parents, or we like to coach parents on, is just asking, how do you like to communicate? Do you want me to send a message through electronic health records? Do you want me? Some parents text their teachers. Some parents have programs like Classroom Dojo that they communicate through with their teachers. How do you want me to communicate? What do you need me to communicate? Like, what information do you need from me? And I actually got asked this by a patient not too long ago, or by a parent not too long ago, that completely caught me off guard. And one way to peel back the curtain is, especially in primary care, but in a lot of medical settings, we kind of rely on spiels, right? When you come in with a need for sleep, we have our sleep thing that we tend to sell people. We kind of run on these kind of, we practice them, we identify them, we know what we say when this concern comes up. But sometimes if you ask the right question, it can stop us and make us think about your unique needs as a family. And one of the questions that came up for me was, what information do you need from me? This is what they asked me and the primary care clinician who are in the room together trying to support them. They said, what information do you need from me to get the best outcome for my kid? And it totally stopped us, and it made us rethink the entire treatment plan, right? And if you think about your role on the team as your child's expert, it really helped us think about the parent as the expert in the kid and managing all the systems that they're trying to manage. It was a really important question to add. I'd highly recommend you adding that to your tool belt of questions to ask during appointments or school meetings. What information do you need from me? Or what information do you need from his medical team or his school team to get the best outcome for my kid? I promise you it'll make the other team member pause and think a little bit more carefully about the needs of your specific kid. We can go to the next slide. Yep. Building relationships with and between team members. So just like we were just saying, asking about who would this information be helpful to, right? How can we share this information? Who might benefit from hearing this information? And what do you need from me? Because often we have to get your permission to share information with other team members. And so letting people know right off the bat that you want people sharing information and who you want them sharing information with and what kinds of information that you want to be shared can be really helpful for your team to be able to promote this team-based care, to build those connections, not just within your team, but between your different teams to make sure that we're getting the best outcomes. And relatedly, make sure that you know clearly that you feel comfortable in what your role is on the team. And the best way to do that is stand in front of a mirror and try to pretend you're talking to a school professional or a medical professional. Stand in front of the mirror and see if you can explain your role on the team in 30 seconds. And oftentimes we feel like we know what our role is, but when we try to explain it, it becomes really difficult to find the right words. And oftentimes in a quick, busy school meeting or doctor's meeting, oftentimes we need to be able to talk efficiently. And so being able to practice kind of that can be really helpful. And then also, does everybody in the team agree with what their role is or what your role is on the team, and making sure that we have a shared understanding of what each team members, including your own, is with everybody on the team can be particularly helpful. And when you don't know, it's okay to just. And that's all I had. So I think we're going to move on to questions and or polls.